So hello everyone, welcome back to another video, and in this particular video I will talk about the various ways of drug administration for the terminally ill or for the end of life patients. We need to appreciate that at some point with progression of disease, drug administration may be altered, may not be as it was previously, because some patient functions may be diminished. Like for instance, patients with advanced esophageal tumors or throat tumors may not be in a position to swallow, so you will have to use alternative ways of administering the drug, because essentially the patient needs the drug. It's just that the mode of administration have changed. So there are various ways which I'll talk about, and I will start with the common ways, the ones we are conversant with. I start with the intravenous routes. This is where the drug is administered into a vein, at a particular point in the body. So the intravenous administration is classified into two. There is the peripheral, whereby the device that is being used to administer this drug is attached to a peripheral vein. A peripheral vein might be on the leg, on the heart, or other points of the body. There are also another type of intravenous administration is the central venous cannula, or chemopods, which are instituted on large veins, like for instance the subclavian veins, etc. So the other method of drug administration is the intramuscular, but you tend to find that this is not so much common, because with advancement of disease there is diminishment of the muscle bulk, which might alter the administration of drugs using the intramuscular route. We need to know that for a drug to be administered intramuscularly, there must be abundant amount of muscles and tissues to facilitate the same. Otherwise, you might administer a drug intramuscularly to a patient who have cachexia, and the end result will be nerve damage or even bone damage. So the other type of drug administration is orally. This is done to a patient who still has the ability to swallow and has a swallowing reflex. Remember, we don't administer oral medication to patients who are unconscious because of risk of aspiration and choking. So there is one type of drug administration that is commonly confused with oral administration, which is buccal administration of a drug. When it comes to buccal administration, this drug is being administered orally, but this patient is not swallowing the drug. The drug is placed between the cheek and the teeth. So the drug stays there, and because of the abundant vasculature of the inside of the cheek, of the soft tissue that forms the inside part of our cheek, the drug is absorbed slowly without the patient necessarily swallowing it. And the most commonly administered drug via this method is morphine. And we need to appreciate that when you decide to administer the drug via the buccal cavity or via the buccal space, you need to double the dose, because the absorption will be 50%. Only 50% of that drug will be absorbed. So like for instance, if you are administering 10 milligrams of morphine 4 hourly, you need to administer 20 mg for that patient, because at the end of it, only 50% will be absorbed. 10% will be in excess. So the other type of drug administration is the sublingual. The sublingual, which involve placement of drug under the tongue and is used to administer slow release drugs or slow release tablet formulations, because the drug is released slowly without the patient having to necessarily swallow the drug. The last method is use of percutaneous gastrotomy tube, or the common which most people commonly refer to as the PEG tube. A PEG tube is mostly found on patients who have throat tumors, or patients whose swallowing is altered. There might also be some other diseases that affect the nervous system, which may inhibit the swallowing of a particular patient. We also need to appreciate that swallowing or gag reflex is controlled by the CNS via the glossopharyngeal nerve, which is the 7th cranial nerve. So for this PEG tube, the drug mostly administered are syrups, because it is not advisable to crush drugs, because for instance, if you crush a slow release tablet drug and administer it via the same route, there might be rapid absorption of that drug. Remember, a slow release drug is meant to be absorbed over a longer duration of time, like for instance 12 hours. So if you administer this drug as a crushed formulation, once it gets into the stomach, because the PEG tube is attached directly to the stomach, there might be, and also we need to appreciate that drugs are absorbed in the stomach. So there might be rapid absorption of this drug to the patient, which might lead to toxicity of the same. So thank you guys for watching this video. For more of these, please like, share and subscribe to this channel, for more episodes. Thank you.